Hello and welcome to the first seminar of Public Health 1. In this seminar, we learn the basic principles that help us understand the concepts of health and disease. Also, we learn the measures we use to quantify disease frequencies among communities, like prevalence and incidence. So let's start with the definition of health. According to the World Health Organization, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. This definition was adopted in the year 1946 and has never been amended since 1948. What you need to think about here is the multidimensionality of health. It has physical aspect, which is the biological integrity, mental aspect, and also social aspect. In the classroom, we will discuss more about the definition of health, but now you need to remember this definition because this is the universal definition of health. Okay? Now let's go to the second concept, which is disease. But be careful, we have no universal definition for disease. And actually, if you ask a cardiovascular surgeon, for example, about what is disease, he or she will give you an answer that will be significantly different from the answer that you will hear from a medical psychiatrist, for example. So, as you can see, we have no agreement or universal consensus on what is a disease. Take obesity, for example. According to most medical researchers and scholars, obesity is a risk factor for cardiovascular conditions and metabolic disorders like diabetes, for example. But other institutions and other medical societies see obesity as a disease itself. So, as you can see, we have still an ongoing debate about the nature of obesity, whether it should be defined as a disease or not. The same happened also with high blood pressure, because we used to call high blood pressure as a risk factor for a number of conditions, especially cardiovascular ones. But recently, we agreed to define high blood pressure as a disease itself, because we know that patients or people with high blood pressure are at the greatest risk of all associated conditions. According to the WHO, there is a list of diseases, which is the ICD-10, or now it's 11, the latest version, but yet there is no clear definition for what constitutes a disease or what makes the disease as a disease. Historically speaking, diseases were connected to human behaviors and sins, if you would like to call it like this. And many mental disorders were seen as sins or mistakes from the humans. But later on, when our understanding for mental disorders evolved, we agreed to redefine these human behaviors. And for example, homosexuality was seen as a mental disorder by the American Psychiatric Association until the year 1973, when the society or the association decided to remove it from the list of disorders. Also, think about aging. Think about conditions like osteoporosis, because osteoporosis was seen as a normal part of aging process until the year 1994, when it was reclassified as a disease itself. The same also nowadays going with andropause, or decline in potency of male seniors, which is currently debated as whether it should be seen as a disease or not. Be careful, because all these debates sometimes are influenced by conflicts of interest, especially financial conflicts of interest from pharmaceutical industry. So, as you can see, the debates are ongoing for how to define diseases, or how to see a disease, or how to define a disease. So we try to find common principles for our understanding of diseases in order to navigate our work. One of these universal theories that we all agree about is called the natural history of disease. And this theory tries to explain the timeline or the process of how diseases grow or evolve in human bodies. First, we start with a human in the wellness state. So this human is completely fit. He or she has no problems. then this human will start to suffer from clinical condition, and this clinical condition will lead to certain outcome. But before the human starts in experiencing this disease, he or she will definitely be exposed to risk factors. So these risk factors could be environmental risk factors, it could be behavior risk factors, could be biological risk factors like viruses, bacteria, and fungi. And all these different types of risk factors will push humans to become ill. And once a human is ill, he or she will suffer from certain outcomes like mortality or morbidity, or in good cases, he or she will recover completely. So this is the universal process of how diseases grow. It starts from risk factors that surround the humans who are healthy. Then these humans start to become sick, and the sickness will lead to certain outcome that could be recovery, mortality, or morbidity. If you would like to describe this process in more logical and clearer way, we have 4 stages of disease development. The first stage is called the stage of susceptibility, and here the humans are completely healthy or seen as healthy, and at the same time they are under the risk of getting infected or getting sick. Why? Because they are engaged with risk factors. Think about smokers. Current smokers are supposedly healthy. We see them healthy or fit because they are young, probably, and we cannot see any clinical problems with them. But be careful, because after this stage of susceptibility, the disease will start to grow in the human body silently or without clinical symptoms, and this is called a stage of subclinical disease. So here the disease starts to develop in the human body without any clinical manifestations or without any clinical symptoms yet. So this is the early stage of the disease development. Later on, the disease will become clinically present or clinically visible, and we will call it the stage of clinical disease. But before we go to the clinical disease, we need to know when the clinical disease starts. So the clinical disease stage starts with the first day of clinical symptoms. So once the patient start to cough or start to have high fever or high temperature or whatever other clinical symptom, we call this as the first day of clinical disease. Then after the clinical disease stage, the patient will have a clinical outcome or disease outcome for his illness or her illness. Okay, in terms of infectious diseases, we can measure the length of the stage of subclinical disease very accurately, because we can define the day of exposure. So this is the day when the person started to be infected or got exposed to the pathogen. Let's say this is a disease of coronavirus or coronavirus disease. So the COVID-19 as a disease starts with getting exposed to the coronavirus here in, let's say, day 0, and within 5 days, which is called the incubation period, the disease will grow inside the human body without any clinical symptoms. We cannot see it yet, but in the 5th day or after these 5 days of the incubation period, the disease will start to manifest itself clinically, and here's the day when the human will start to cough or start to have respiratory symptoms. Okay, be careful. This period, which is called the incubation period, is only and exclusively applicable to infectious diseases. It cannot be applied on non-communicable diseases like diabetes, cancer, or other conditions. Okay, so remember that we have different types of diseases: infectious diseases and non-infectious diseases or non-communicable diseases. This principle, which is the incubation period, is only applicable for infectious diseases. Okay, in order to control diseases while they grow in this timeline, we have different levels of interventions. The first level of interventions are called the primordial prevention, and these are the interventions that we apply in the very early stage of the disease development, which is the stage of susceptibility. So before the people start to be sick or even start to get engaged with risk factors, we can apply some rules or some changes in the community or in the society to make them away from getting engaged with risk factors. Think about raising taxes on tobacco. This will make the substance, which is tobacco, less accessible to a number of individuals, especially young individuals or less economically advantaged groups. Okay, so this is the primordial prevention. It's a level of interventions that aims to change the society or the reality where the humans live. Then we have the primary prevention, and here we try to protect the individuals themselves, or make them immune from getting sick. And the best example for primary prevention is vaccinations. So these are the interventions we apply before the subclinical stage. So we know that the humans are already exposed to the pathogens in their community. We cannot remove the pathogen entirely from the society. It's not possible. So in this case, we try to focus our work on the individuals and try to protect them. Then we have the stage of clinical disease, and before the stage of clinical disease, the humans had been already staying in the subclinical disease. And secondary prevention tries to come here in the point between subclinical and clinical disease in order to find the disease in very early stage during the subclinical stage and try to cure it. So this happens only by screening and checkups. So regular checkups or frequent checkups and mass screening are the best examples for doing secondary prevention, because by this you can discover the individuals who have the stage of subclinical disease or have the disease while it's silent, and find the disease in them and start to treat it in this early time. Then if the patient already has a disease and the disease is clinically present, and this time you can only apply the clinical treatments and tertiary prevention in order to decrease the consequences or the bad consequences of illness. In the second week or in the second seminar, we will go through these levels of prevention in more detail. Just for now or for today, try to remember these 4 levels of prevention and the 4 stages of disease development: a stage of susceptibility, a stage of subclinical disease, a stage of clinical disease, and a stage of clinical disease outcome. Okay, this question, which you see here, why disease occurs, was a very old question in humans' history. And we tried all the time to find an answer for this. Why disease occurs? Why some people get sick while others are fit or not sick? So, looking at the history of humans, we can see different types of theories for explaining diseases. The first group of these theories are called supernatural theories, because they had no clinical or no scientific or no empirical evidence to explain diseases, how they occur, and also they had no way to validate their suppositions or suggestions. The first example for supernatural theories are the demonic theory. And the demonic theory, as you can see it here, tries to explain the disease as a result of demonic possession. So the demons or the bad or the evil spirits came to your body and they dominated it and they made it sick. That's why you are sick. As you can see, this was very early and very, I would say, funny as well, according to today's understanding or today's standards. But at the same time, this was the theories at this time or at this early time. So these kind of thinking or these kind of theories led to some practices to treat diseases, like exorcism or sacrifices to cure the diseases. Yes, this was a little bit cruel, but as you can imagine, this was very early in our history. And believe it or not, these theories were somehow helpful, because when you exclude the people from your community who are demon possessed or the demons possess their bodies, you are protecting the others from getting infected from them. So yes, it was a little bit cruel, but at the same time, this was somehow effective at this time or at this stage. Later on, when humans had the religious beliefs or religious thinking, the demonic theory became punitive theory, and now the disease is not a result of demons possessing your bodies or possessing your soul, but it's God or the gods who punishes you through having a disease. So the disease is a result of bad behaviors and or sins, and these sins or bad behaviors led to your punishment in this way. Okay, remember that these theories were the earliest stage in our history, and they lack any clinical or any scientific evidence, yet they were broadly adopted at these times. Then we had the second level of theories, which are the philosophical theories. And the philosophical theories are more or less associated with old civilizations, especially the Greek civilization. And the first example of these philosophical theories is called the Humoral Theory. And the Humoral Theory tries to explain the disease as a state of imbalance between the human body humors. So the human body is consisted of four substances or four humors, and these four humors or these four substances are the blood, the phlegm, the black bile, and the yellow bile. So these four substances are supposed to be in constantly balanced state in order to stay healthy. And once this balance had lost or had been lost, the human body will start to get sick. And this imbalance is lost, or sorry, this balance is lost due to usually environmental changes or some changes in the ecosystem where the humans live and function. So this was the first theory, and this theory, as I said, dates back to the Greek physician's time. Then the second theory from this time was called the miasmatic theory. And the miasmatic theory explains diseases as a result of bad air. So miasma in Latin language or in Latin is the noxious vapors or the bad air or the bad smell. So this bad smell or this bad air happens and it leads to mass deaths in the societies or in the communities. This theory was one of the most surviving theories because it was prevalent and adopted until the 19th century. And after the 19th century, it became less popular after the work of John Snow that we will learn about in the third seminar. But for today, you just need to remember the miasmatic theory was another example for philosophical theories. Then you have the contagion theory. And the contagion theory started really early in time. It was from the Hippocrates time, the father of medicine, if you hear about him. And he tried to explain the reasons why people get sick with some diseases, especially tuberculosis. But he had no microscope, he had no method to discover the reason for this illness. So he assumed that there could be something abnormal with their bodies that happened or was triggered by touching other objects or other things. He was not able to describe the pathogens because he had, as I said, had no microscopes or no tools to describe the rules, but he somehow assumed this. Centuries later, and here we talk about the 16th century, an Italian physician called Girolamo Fracastoro, I hope that I said the name correctly, came to develop or build on the theory and wrote his book about this theory, the contagion theory, and he described these small seeds or these contagions that are responsible for transmitting diseases from one human to another. So this theory was the base that was built upon the first scientific theory that we will see very soon, which is the germ theory. So Fracastoro was also unable to describe the exact role of these small pathogens or these small microbes. However, he came very close to this point through his work and his experiments. Then, in the 18th century, we started to see, or sorry, 19th century, we started to see the scientific theories. And the first scientific theory is called the germ theory. This theory describes the diseases as a result of infection. So all diseases at this time were, the common diseases were linked to pathogens like bacteria, viruses, and fungi, or even parasites. And this infection, or this germ that is caused by infection, will lead to clinical course or clinical disease, and these clinical disease or clinical course will have symptoms, and these symptoms can be treated by vaccinations or antibiotics, and vice versa. So if you have vaccination from the beginning, you can also stop the infection. So this theory was amazing because most of diseases at this time were infectious diseases, were caused by infections. But be careful, because not all diseases that we see today are caused by infection. Think about diabetes. Diabetes can never be linked to any pathogen or any microorganism. It's in fact a non-communicable disease. So by the time and by advancement in medicine and in public health, these infectious diseases became less popular and more non-communicable diseases became popular. So medical scientists became challenged by how to explain the non-communicable diseases like cancer, diabetes mellitus, cardiovascular disease, and many others. And so the epidemiologic trait theory came to try to explain this. So it explained the disease as a result of a triangle or a trade of factors. So the first factor is the host, which is a human or the person or the organism. Then the agent, which is the pathogen or the microorganism, and then there is the environment. Yes, it's not so different from the germ theory, but yet it gave more emphasis to the environment and the external factors to facilitate the disease transmission. That's why it's called epidemiologic trait. Then we have the third theory, which is called the epidemiologic tetrad, and it's not different from the previous theory because it has the three elements of the epidemiologic tetrad, which is the agent, the host, and the environment. And in addition to the these three factors, we have the time as the fourth factor. That's why it's called the epidemiologic tetrad. Okay, so now we have four factors: agent, host, time, and environment, but yet we cannot really understand how cancer happens, for example, because there are many other factors related to the environment that we live in that we cannot see or we cannot clearly explain using this tetrad. Then, in the 20th century, we started to see the more complex theories like the wheel theory. And the wheel theory described the disease as a result of interactions between the four levels of environment where humans live. So these levels like social environment, physical environment, biological environment, genetic core of the human or the host, all these factors interact with each other in order to lead to the disease. Yes, it's a great advancement because you can see the different dimensions of health that we described at the very beginning of today's seminar when we described the health definition, but yet we cannot see the exact interactions between these environment levels. Like we cannot see how, for example, the social environment affect the biological environment or vice versa, how the interactions go. So if we cannot see these interactions or these arrows that link these environments to each other, we cannot decide what are the interventions that are suitable for controlling these diseases. So nowadays or today, we have a group of theories that are called the web of causation theories. So the web of causation theories are, for example, here, as you can see, it's a complex of factors and risk factors specifically that interact with each other in different ways in order to lead to the disease outcome or the disease incidence. So let's take ischemic heart disease as an example here. As you can see, age, education, and income are the determinant of health that can control all the subsequent risk factors. For example, age can control the overweightness, alcohol consumption, smoking behavior, and even physical activity. The same also for education. People with good education could think more carefully about their fat intake, about their alcohol consumption, about their smoking behavior, also about their physical activity. Vice versa, the people with lower education level. So the education level in general can mediate or moderate the risk factors that you can see here, the first level of risk factors. And these first level of risk factors, the physical activity, fat intake, overweight, alcohol, and smoking, can also control the second level of risk factors, which is the diabetes type 2, the cholesterol level, the blood pressure, which are the biologic risk factors for ischemic heart disease. And these biologic risk factors for ischemic heart disease will control significantly the disease incidence or the disease outcome. So all these interactions that you can see here in this map should be visualized like this in order to decide what are the interventions that are suitable for your communities or your individuals in terms of disease prevention or disease control. This theory can be applied to any kind of disease that we see today, and each disease has its own web of causation model. Okay, so these were the three levels of disease theories or three types of disease theories. The first group was supernatural theories. These were the oldest ones. They had no scientific evidence or scientific explanation for the disease. occurrence. Then the second level were the philosophical theories, and they were based on environmental observations that were analyzed using philosophy or like critical thinking. However, they had no empirical evidence yet, and these were the humoral, miasmatic, and contagion theory. And finally, today we have the scientific theories that are based on scientific evidence, starting from the Germ theory, epidemiologic trade, epidemiologic tetrad, wheel theory, and nowadays we have the web of causation theory. Okay, so these were the theories of disease causation. Now let's go to the types of medical question. But before we see the types of medical question, let me show you two important disciplines. The first is clinical medicine, which you're studying now because you want to become medical doctors. And in addition to clinical medicine, we have a very crucial science, which is epidemiology, and this is the science of studying diseases. In the third seminar, we will have more focus on epidemiology and you'll understand it more like deeply than now. But let's see these two different disciplines that interact with each other in order to produce an interdisciplinary area or this interdisciplinary field, which is called clinical epidemiology. So clinical medicine focuses on individuals. As a medical doctor, you will try to treat or cure the diseases in individual or patients. However, in epidemiology or in public health medicine, you will try to focus your efforts in curing and protecting communities. And in between these two levels or these two sciences, we have the clinical epidemiology as an interdisciplinary area. And by the way, this course of Public Health 1 is more or less oriented to cover all the subjects or topics of clinical epidemiology that you should learn as medical doctors. The interaction between these two fields lead to clinical epidemiology, and clinical epidemiology tries to give you the epidemiologic evidence that helps you in deciding about patients' care. So as a medical doctor, you need to understand the principles of clinical epidemiology in order to understand how the medical literature is written and how to use the information from medical literature to decide about your patient's care, which medicine you will give or which surgery you will perform based on the medical literature that you will read. Okay. In fact, as a medical doctor, you will have a variety of questions, which are the medical questions, as you can see, that are answered by different domains of epidemiological studies. For example, if you are unsure if the patient is sick or not, then you are thinking about the definition of abnormality. And definition of abnormality will be more or less explained in the fourth seminar of this course. In this seminar, in the first seminar, we will discuss about the frequency of diseases, how often disease occur in a community or in population group, and this will be the focus of this course, the focus of this seminar this week. In the second week or in the second seminar, we will focus on prevention. For example, does an intervention on will people keep disease from rising, or does early detection and treatment improve the course of disease? All these questions can be answered by the knowledge domain of prevention, and also with diagnosis, which will be also covered in the second seminar. How accurate are the tests that we use to diagnose the diseases? Then in the fourth week, we will talk about risk and how factors or what factors are associated with an increased risk of the disease. The same also for prognosis, that will be in the fourth week. The fifth week will be about treatments. How does treatments change the course of disease? And finally, in the final week of this course, we will talk about causality and epidemiologic causation. What conditions lead to the disease and what are the origins of the disease? I hope that you enjoyed this brief pre-seminar record. I hope that you watched it before attending the seminar, as I said, and I'm looking forward to seeing all of you this week and the next week in the seminar room. Good luck. Thank you.